Welcome to the MenMD podcast, where we explore real questions, expert answers, and everything men's health. In today's episode, we're sharing the Q&A portion from our May webinar featuring Dr. Peter Bayach. You'll hear Dr. Bayach respond to audience-submitted questions about Kysotrex, the first and only FDA-approved oral testosterone therapy. And whether you're new to TRT or an experienced candidate, this episode offers practical insights on oral testosterone options and what makes Kysotrex unique. Let's dive in. Alrighty, so we're going to start off with, can increasing my testosterone levels help with ED?
It's a great question. The short answer is yes, okay? But it's important to know for most men, particularly men who are in their 50s, 60s, and beyond, ED is usually primarily a blood flow problem, okay? That's a blood flow problem that happens from cardiovascular disease, hardening and narrowing of the arteries from conditions like high blood pressure, high cholesterol, diabetes, smoking, etc. Testosterone plays a part. So if you have a testosterone deficiency, it can make your erections weaker. It can also make oral medications like sildenafil, which is the generic form of Viagra, or tadalafil, which is the generic form of Cialis. It can make those less effective. So I always, in my patients who experience erectile dysfunction, check a testosterone level, especially if they don't have those risk factors, those cardiovascular risk factors. Then I feel, much more confident that testosterone might be the main issue going on. But certainly anybody with a testosterone deficiency is going to get a boost in their erectile function when they get their testosterone back into the range that it's supposed to be.
Alrighty, definitely a great question. Next question here, can testosterone replacement therapies such as gel injections, oral therapies help produce or increase low semen production?
That's another great question. So semen production is also a complicated thing. So there's production and then there's how much comes out, okay? And there are a number of factors that can affect how much you're seeing come out of you when you do ejaculate. In men, particularly in men, 50 and up, the most common reason that your ejaculatory volume might be reduced is actually most commonly as a side effect of medications. Like alpha blockers, like tamsulosin, which is a common prostate pill. It's probably the most common side effect, okay, causing decreased volume of semen coming out. It's also something that can happen with diabetes, okay? If those are not something that you're dealing with and you're experiencing decreased semen volume, I would say that definitely if your testosterone level is deficient, it can impact semen production, and it can impact it in a lot of ways. Testosterone is important for normal sperm production, which only makes up a small percentage of the semen, but it also impacts, the fluid produced by the prostate, probably the fluid produced by the seminal vesicles. So definitely we do see that in men who don't have another reason for having decreased volume of ejaculation, when they start testosterone replacement therapy, they might report that their semen looks more like it used to.
Okay, next question here. Once you start an oral testosterone therapy treatment plan, would you need to continue this for life or until testosterone is in the normal range?
That is such a good and important question. So testosterone replacement therapy in and of itself does not jumpstart natural production of testosterone. So just like some people have a thyroid hormone deficiency, they take thyroid hormone as an oral medication. It doesn't make their body produce more of it naturally. And in fact, if anything, it might actually, to some degree, if your dose is too high, it may de-incentivize your body from even wanting to produce more because it's already there. Why would the body work hard to make it? But what's interesting is that there's also like a lot of lifestyle factors that can contribute to testosterone deficiency. So testosterone production can be a reflection in some ways of your overall health. So if you're, eat a poor diet, you get poor sleep, you're overweight, you've got health issues, you're not taking good care of yourself, your natural testosterone production will be affected. And it can be really hard to do the things that are necessary to get yourself back in shape, to get the exercise, to get, the right kind of diet. And if your testosterone level is deficient, you're going to be struggling to get motivated, you're going to be struggling to get the weight off. So what's interesting about testosterone replacement therapy and guys like that is that it can really jumpstart your ability to get your health on the right track. And it's not uncommon that I have men on Kysotrex who, after a period of time of being on it, and they're getting back in the gym, they're their relationship is doing better, they're happier, they're less depressed, they're getting a better handle on their overall health. And what we find sometimes is that as we're checking their levels, it's like they're getting higher and we're not making any changes. So we end up scaling the dosing back over time. And as long as we keep seeing those levels looking good, sometimes I'm even able to stop it. So it's not so much that it kick-started the body's natural production just from the pill, but it allowed you to kind of have some of those important lifestyle things that can make your body more healthy and make it start working more like it's supposed to. So that doesn't always happen, but if it doesn't happen, it is something that you would be kind of, if you wanted to keep getting the benefits of it, it's something that you would be expected to be on long term, forever.
Alrighty, let's see. We're gonna ask some more questions here. So this one is asking about how Kysotrex affects fertility or the preservation of fertility, and maybe we can answer it with Kysotrex and TRT in general.
It's a great question. So it's really, really critical, I would say, to know that one of the side effects of testosterone replacement therapy, no matter what type you use, is that it decreases sperm production. Okay. Testosterone replacement therapy is not considered an effective form of birth control for men, but it can contribute to infertility. Now, what we don't really know is what is the best testosterone approach for a guy who is trying to maintain his fertility. And there are some options of how we can boost testosterone without using testosterone replacement therapy, specifically for men who are actively trying to conceive. There's other medications that we can use that will not suppress the sperm production. Now, in general, our thought among experts in the field is that shorter acting testosterone, especially if given in a reasonable dose that's not excessively high, probably has less of a negative impact on sperm production and other factors in the body compared to the higher dose, longer acting forms of testosterone like pellets and like injections. So if I had a patient who really wanted to be on some sort of testosterone and was planning on maybe not having a kid right now, but within the next couple of years, and he wanted to know what is the type of testosterone that is going to be least likely to impact his future fertility. Although I don't have any really solid concrete science to prove it, I think most experts would agree that a short-acting testosterone like oral is going to be least likely to impact that. And there is some suggestion, some preliminary data that suggests that oral testosterone may have less of an impact on some of the hormones that come from the brain, like LH, that are then important in stimulating the testicles to, encourage them to do their thing, which is producing testosterone and producing sperm. So that's kind of the long answer. The short answer is we're not sure yet, but probably oral testosterone is the best option of the testosterones. But still, if you're planning on actively trying to have a kid, you should avoid testosterone and instead work with a fertility specialist to consider other options that are not testosterone that can boost your levels while you're actively trying to conceive. And then once you're done having kids, you can get back on testosterone, which is going to be more likely to make you feel better.
Alrighty, perfect. So talking about Kysotrex, this person asks if this product is okay to use if you have recovered from prostate cancer. I've seen this question definitely a few times too.
Yeah, great question. I just touched on it ever so slightly during the talk. So the first disclaimer is that we don't fully understand the relationship between testosterone and prostate cancer. Okay, but the available research that's been done suggests that testosterone replacement therapy, when you're taking a guy from the low testosterone to normal, does not cause or contribute to prostate cancer. So I can speak to my own personal experience as a specialist who sees men for testosterone deficiency and also prostate cancer survivors. It makes up a big part of my practice. I feel perfectly comfortable treating testosterone deficiency in men who have treated prostate cancer, who have no evidence of, recurrence. So for example, a guy who had his prostate removed for prostate cancer and his PSA is undetectable for, a reasonably long period of time. To me, that means he does not have any more prostate cancer. I have no hesitation in treating that guy's testosterone deficiency. Even a guy who's had radiation and his PSA has looked great, it's been consistent, his radiation oncologist gave me the all clear, we can start that guy in testosterone. Where it gets a little more, tricky and requires a little closer monitoring, I think, is guys who, maybe their PSA hasn't, let's say after radiation, it has come down, but maybe rises a little bit. Those are ones where it's really a ongoing conversation with the radiation oncologist to weigh the pluses and minuses, because we know that starting a guy on testosterone does increase that PSA blood test. That does not necessarily mean that it, is making cancer worse or anything like that. So we kind of have to understand the relationship between the testosterone and the PSA. And admittedly, there's a lot we still don't understand about that. Guys who are just monitoring their prostate cancer, who have a very low risk type, let's say like a grade 1 out of 5, who have a testosterone deficiency, that's somebody I'd feel comfortable treating with close monitoring. The guys where we really want to avoid testosterone are the ones who have advanced prostate cancer, where it's metastatic, it's spread to other areas of the body. That is a situation where we really want to avoid it. So the short answer is it's complicated, and I think it's best if you have prostate cancer and testosterone deficiency to have your testosterone managed by a urologist who has expertise in both conditions.
Certainly. Thank you for answering that question. There was a lot of people interested in that one. Next up, we have, along the same lines, I think, kind of, because you just mentioned one case where you would not want to be taking TRT. So to continue that, who would not be a candidate for this medication?
Good question. Number one is somebody who does not have a testosterone deficiency, right? So what we're talking about here is treating testosterone deficiency, which is a medical condition. Now, going back to the beginning where I said, if you have a testosterone of 299, you're low, but if you have a testosterone of 300, are you normal? I don't necessarily feel that we need to be completely absolute about those numbers, particularly if it's somebody who's younger. You kind of expect their testosterone to be a little higher than somebody who's older. So there is a little bit of interpretation that needs to happen if the symptoms really seem to fit. I think there's probably a little wiggle room in those ranges, depending on the comfort level of whoever's doing the prescribing. So that's one. I think people who really, really hate taking pills, like I see some of these guys out there, they've never been on a pill in their life for anything. To them, it's easier to, once every 3 to 4 months come in for a pellet implantation or something, and they don't want to have to think about taking a pill. Like that's probably not a good candidate for an oral testosterone, because it is something that you have to take twice a day, and if you miss a dose, your level is going to be low. I think it's great for people who are already taking other medications, especially if they're, taking medications twice a day. They could just kind of add it into their, medications they're already taking. Who else? Let's see. Those are the main ones. Honestly, I think everybody who can get their hands on it, I think this is a great option. I wish it was the first line therapy. Maybe one day it will be, but I think it's going to take some time because it's a relatively new medication. Perhaps another one would be like somebody who has really wildly out of control blood pressure already, and they're not, taking their medications. They're not working with their doctor to take that, because Kaisertrex does have that about 2% risk of increasing blood pressure a little bit. In your average guy who's got well-controlled blood pressure, that a couple points of higher blood pressure is not a big deal, but in somebody who's really already at super high, higher than they should be, maybe get that under control first before starting Kaisertrex.
Certainly, and that is actually going to lead us into our next question, which was asked during the slideshow, but it's a follow-up to that blood pressure side effect. How high is too high to start with a guy that wants to get on TRT or Kaisertrex?
Yeah, good question. I think that's a conversation best had with whoever manages your blood pressure, whether it's your primary care doctor or your cardiologist. And if you don't have somebody managing your blood pressure, then you need to go and get that first. I don't remember the exact numbers from the studies, but the increase in blood pressure was like a couple points. We're talking like if you're normally 120 or over 80, you're going to go up like 123, 124. Like that's not really a clinically significant issue. But if your blood pressure is high enough to the point where you're getting symptoms from it, whatever it is, having it go a little higher may be dangerous for you. And that's a conversation that really you should have with your primary care doctor. First of all, ask them why can't we get my blood pressure better controlled? A lot of guys I see who have out of control blood pressure, it's because they don't necessarily agree with what their doctors recommended to them. And I think the bottom line is, um, you know, having high blood pressure that's out of control is eventually going to kill you, and you need to, work with your doctors to figure out something that you can do to get that under control. Because if your blood pressure is really that out of control that you can't even start Kaisertrex, you got bigger problems than testosterone deficiency.
Alrighty, perfect. Next question here. This person says they take 10 milligrams of tamoxifen, if I said that right, daily, and wanted to know if Kaisertrex will have fewer side effects.
I'm not sure if the question is if you take Kaisertrex in place of tamoxifen. I mean, tamoxifen is not. What's that?
I don't know. I believe that's the question, but I'm not sure myself if those are comparable.
Yeah, I mean, I wouldn't consider tamoxifen to be a standard treatment for testosterone deficiency, which is really what we're talking about here as an indication for Kaisertrex. So I wouldn't necessarily be able to speak to, in the setting of this talk, to speak to like how Kaisertrex might be different as far as side effect profile from tamoxifen, but that's a question I could always answer offline out of the setting of this talk, which I really kind of just need to stick to the intended use of the product.
Alrighty, we appreciate it. Next question here. How long after you began a Kaisertrex treatment does it take effect to see results?
Great question. So, historically, when I've started things like injection therapy, I usually tell guys a couple months till you really start to see the benefit. But just my own personal experience in prescribing Kaisertrex, I mean, guys really start to notice a lot of improvement right away. I do think there's certain things that are more subtle that maybe take some time before you really start to appreciate it, like the mood changes and mood improvements, and things like that. So I would say you should start to notice some benefit within the first week or two, but you're really going to continue to find new benefits even for the first couple months. One of the red flag things that I didn't bring up that I think is important for guys to understand is if your testosterone level is deficient and you start testosterone and it doesn't help, or perhaps even makes things worse. One of the most commonly, I would say, underdiagnosed things that could be contributing to that is sleep apnea. Sleep apnea is a sleep disorder that impacts the way you move air while you're sleeping. Essentially, it causes you to basically suffocate. People who have sleep apnea, they snore loudly, they stop breathing while they're sleeping, they wake up feeling tired. And many men with sleep apnea that's untreated have testosterone deficiency. Why does that happen? Well, when you have sleep apnea, you do not go into the deep and restful stages of sleep, like REM sleep. And REM sleep is actually when you produce testosterone. So if you never go into REM sleep, you're not going through that phase of sleep where the testosterone is actually being produced. So you're going to have testosterone deficiency, and you're going to feel like crap for two reasons. Number one, because you're not getting good sleep from the sleep apnea, and number two, because your testosterone level is deficient. The problem is if a guy has sleep apnea that's either undiagnosed or he's not willing to, listen to his doctor about doing the treatment that he's supposed to do, starting testosterone can make sleep apnea worse. So to me, it's always a red flag when we start testosterone and a guy says, hey, I don't really feel better. In fact, maybe even certain things are getting worse. Or the other red flag I see is if the blood count starts going up. To me, if the blood count starts going up, that means they have sleep apnea. It's making the sleep apnea worse. The oxygen levels are dropping while they're sleeping, and their body is smart and detects that, and it starts putting the bone marrow into overdrive and producing more red blood cells. And that's what causes the hematocrit to go up. So the take home here, if you have a sleep issue, if you snore, if you stop breathing while you're sleeping, if you've never had a sleep evaluation, talk to your primary care doctor about getting a home sleep study. If you've been diagnosed with sleep apnea, do the treatment. It's usually either a mask or a mouthpiece. You may experience a significant improvement in symptoms just from that. And the symptoms that you had attributed to testosterone deficiency may, oftentimes get better. But most importantly, even if they don't, you need that sleep apnea treatment to make that testosterone replacement therapy safer and more effective. So if you have sleep apnea and you're compliant with your treatment, whether it's your CPAP or your mouth guard or whatever it is, you're going to get the benefits of testosterone much more than if you don't, because no matter how much testosterone you're on or how much what your levels are, if you're not getting sleep, you're going to feel bad. You're not going to want to have sex. All of these things that we're talking about as far as symptoms, depression, etc. The symptoms are the same. So I cannot stress enough, because it's one of the most common conversations I have with my patients, the importance of sleep, the importance of, if you have sleep apnea, getting it treated, not just to feel good, but because sleep apnea is also associated with a number of horrible health conditions, and people who have untreated sleep apnea simply don't live as long. So do yourself a favor, get the sleep apnea treated, and if your testosterone level is deficient, you get that treated too. You're going to feel like $1 million. That's my rant about that for today.
Alrighty, sweet. Next question here. Is there less risk of elevated estradiol with Kysotrex versus injections or pellet therapy?
Great question. So I will dispel another myth, okay? Estrogens are not bad. There's this like weird, I don't know where this comes from, but there's this weird like concept that testosterone is for boys and estrogen is for girls. And if you have estrogen as a boy, you're going to like turn into a girl or something. It's just simply not true. Estrogens are critical for bone health. They're critical for normal orgasmic function. And there is like, for some reason, this crusade to anybody that has a slightly elevated estradiol level to add additional medications to get rid of that. And I used to do this too, because I was kind of trained to do it, but there's really no evidence to say that that's helpful or necessary. And I always ask even experts, what symptoms are getting better when you're dropping the estradiol down? Really, there's really none. If you drop the estradiol down too low, guys get osteoporosis, they get brittle bones. It's not good. So for me, the only time I worry about the estradiol level is when there are breast symptoms, breast pain or tenderness, or rarely some people can even get breast discharge. If you don't have those, I don't get too worked up about the estradiol. Now, it's important to also know that in the fat cells of the body, testosterone is converted to estrogen through a process called aromatization, okay? So a common medication prescribed in guys whose estrogens are too high is anastrozole, which is an aromatase inhibitor. It prevents the conversion of testosterone to estradiol. So to put it in another way, the more obese a guy is, the more likely his estradiol is going to be higher, because he's shunting testosterone into estradiol. We can simply just dose the testosterone to achieve a testosterone level that is where we want it to be, where he's getting good symptoms, and probably not worry that much about the estradiol unless he's having those breast symptoms, like I said. As far as different types of testosterone and how much they affect the estradiol versus how much they do not, just like what we talked about before, the higher dose, longer acting types of testosterone, like injections and pellets, are probably going to be more likely to cause a rise in the estradiol level. And perhaps, we don't know this, we need more research, but perhaps even a higher rate of breast symptoms. Whereas a short acting testosterone like Kysotrex, where when you go to bed at night, you're pretty much down to what it would be naturally, where it's pretty low while you're sleeping. When you don't really need it, your body is kind of rebooting for the next day. You're not getting any aromatization at night, right? So your estradiol level is not going to be as impacted. But just to kind of reiterate again, I don't get worked up about estradiol. I still check it just so I see where it is in case they develop breast symptoms, but I don't kill myself to try to bring it down to the normal range, because it doesn't really impact any symptoms.
Alrighty. Let's see. Next question here. We got a couple questions about combining Kysotrex with other treatments. So one is about with testosterone cypionate, and one is about using it with testosterone gels. So I know it probably depends on the desired level they're looking for, but maybe you can answer those both in one.
I probably treat thousands and thousands of guys with testosterone a year. I cannot conceive of a single situation where that would be necessary. I mean, to me, it just sounds like you're trying to hack something that really has no business being hacked. You can achieve a desirable level with Kysotrex alone, period. There's no reason to be adding in another type of testosterone. What could possibly be better than replicating your body's natural diurnal variation in testosterone, which is going to be most closely emulated by Kysotrex compared to other things? I really see no reason to ever combine that with another treatment, quite frankly, of any kind, but definitely not another type of testosterone.
Sweet. Alrighty. Got time for about one or two more questions here. So what is the difference between Kysotrex and enclomiphene? And we might have touched on that a little bit, but which one is safer? They want to know.
Great question. So two different types of drugs. Okay, so there's clomiphene and enclomiphene, and then obviously testosterone, which, Kysotrex. So clomiphene and enclomiphene work by a completely different mechanism. Okay, the way that those work, and by the way, clomiphene is FDA approved for treatment of infertility in women. It is used off-label, meaning it's not FDA approved for it, but we use it for men who have testosterone deficiency, primarily those who are actively trying to conceive or who want to preserve their fertility. Okay, that's when we use clomiphene, and enclomiphene is kind of a newer variation of that we use in the same exact way. But the way that it works is it actually blocks what's called a feedback loop of estrogens in the body on the brain. Because what happens is testosterone is converted to estrogen. And as estrogen levels rise, the brain detects that, and it basically perceives that as meaning that the testosterone levels are getting high. So it decreases testosterone production. The higher the estrogen gets, the lower the testosterone production gets. Okay. So clomiphene and enclomiphene block the ability of the brain to detect that estrogen level being high. So what happens is the estrogen level can get higher without the testosterone level being suppressed. That means the testosterone is kind of blind to that, or the brain's kind of blind to that, so the testosterone level goes up, estrogen level goes up. So what would you expect the estrogen level to be, or estradiol level to be in somebody on one of those drugs? It's going to be higher than expected. That's just a normal part of how it works. In my experience with clomiphene, I think it does a very good job of making the blood levels look good, but I think most experts would agree that the patients taking clomiphene do not feel as good as guys who are taking testosterone, and we don't fully know why that is. Okay, so I think it does a good job of making the blood tests look good. I don't think it does as good of a job of making guys feel as good. In general, Clomid is considered safe. There's really not any major side effects I think are worth noting. It does increase the estradiol level, but like I said, that's not something I get too worked up about. Enclomiphene is a newer kid on the block. It's used more and more. I don't have a ton of experience with it, to be honest. There's just not a lot of patients I see in my practice that are using these drugs. But what I've heard from my colleagues who use it, more so in the infertility space, is that it maybe guys feel a little bit better on that than they do on the Clomid. And maybe it doesn't raise the estradiol up as much. But if a guy is coming to see me because he has symptoms of testosterone deficiency, unless he's like actively trying to conceive or is going to be conceiving in the near future, definitely testosterone is going to lead to more symptom improvement. Okay, so I don't really consider them as like analogous to one another, Kysotrex versus Clomid / enclomiphene. I really consider them treatment options for very different patients. Testosterone for guys who are not actively trying to conceive.
Alrighty, perfect. I think that explained that very well. That is going to bring us up to the end of our event, unless you would like to answer one more final roundup question I have here, which is a bit of a review.
Yeah, we could go with that one.
Right. So this one is basically a review, I said, but how does one qualify for a prescription for Kysotrex?
Great question. So qualifying for a prescription for Kysotrex just means having testosterone deficiency. So what you need to do is, first of all, you should have some symptoms that we can attribute to testosterone deficiency, in other words, a reason for us to check it. And then we need to check a testosterone level. Like I said, should be drawn in the morning before 11 a.m. ideally. And if your level is low and the symptoms kind of fit, then you're a candidate for it. And then the move would be that we then try the medication, see how you do. If you feel like you're not having improvement in those symptoms, then I would, definitely be asking you, are there any other potential conditions that could be explaining those symptoms, like sleep apnea? And if there's not, then, we want to make sure your levels are appropriate. So we need to, once you're on treatment, check the levels, make sure that they're in that kind of desirable range, which is going to be the upper range of the normal. And I would expect you to be feeling better. If you're not, then that would probably point towards it not being a testosterone issue that's causing your symptoms. Perhaps it's a side effect of another medication or another health issue. So just to kind of, wrap it all up, I would say, if you think you might be experiencing testosterone deficiency, start the conversation with your primary care doctor, start the conversation if you want with, a testosterone specialist, get the necessary testing and talk to them about Kysotrex as an option for treating it if you have it. And, I just also want to emphasize that the importance of leading a healthy lifestyle, getting the exercise, eating a healthy diet. For men who have a testosterone deficiency, it may help to get on testosterone for a period of time to help you get your health habits in better check. And that may actually facilitate your body's natural production even more. So can't stress enough the importance of initiating that conversation. For those in the room that are, maybe more of a prescriber, do not fear prescribing oral testosterone. It's not what you learned in med school. Methyl testosterone is gone. This is a new generation, a new age, and I really think that this treatment will, hopefully in the very near future, really become the standard of care, because it's just so much better in so many ways than many of the other treatments we were having to use before this became available. So I just want to thank you very much for the opportunity to talk to you all. I want to thank MenMD and Marius Pharmaceuticals for helping to facilitate this presentation. And I look forward to, continuing to spread the word on this great treatment. So thank you all again.
Thank you for tuning in to this Q&A session with Dr. Peter Bayach on Kysotrex oral testosterone therapy. If you'd like to learn more, please visit menmd.com/Kysotrex or connect with your MenMD personal health assistant today. And don't forget to subscribe to the podcast for more expert insights on men's health. Until next time, take care, stay healthy, and keep the conversation going.